Hi, today I'm going to show you cupping. Cupping technique is becoming more and more popular in the United States, especially after this year's Olympic. Michael Phelps, you can see the circle mark result of the application of the cupping. But this kind of technique has been widely used in China in the Asian medicines. In the old time, when there's a war, when there's a people who got sick and they think that the circulation is not doing well, we call the blood stasis, or the energy is blocked. One of the ways to help to eliminate the blood stasis, or called the stagnation, or the energy blockage, is by using the cupping technique. In the old time, spoon cups because there's no glasses in the old time. But now they gradually use the glasses because it's more convenient and they can manipulate the glass a lot better and also help with the durability as well. And this is the old one, conventional cupping that they are using. What they normally do is that they're going to use a fire to move inside, try to expel all the air to create a vacuum effect. This vacuum effect will help the body or help the meat that is underneath the cup to be pulled up, and that will help to improve the circulation, facilitate or regulate the qi flow, and eliminate the blood stasis. The alcohol that we use normally should be 70% or above. This will create a little bit more combustion effect, so the fire will not extinguish by itself. So first, we put the alcohol inside the cotton ball, and then we use the forceps. We use the lighter to light it up. The alcohol, and then we're going to swab inside the cup for a couple of times and then move there. When you cup there, the cup should not move. If it drops, that means that some air is already in, and it is not enough that you expel all the air in the cups out. In that case, you need to start doing it again. That is coming out, okay? And I'm going to show you to do one more time. Light up. And in some case, you need to be close to the body. And then you blow, extinguish the fire so that you don't burn anything. Usually, you want to stay these cups for about 3 to 5 minutes. And you can put the cups along the muscle. Okay? And for this kind of technique, usually you want to do it on the muscle area. We do not normally do it in the bony area. That's one thing people always make a mistake. They always think that they can do these cups anywhere they want, which is not exactly true. And the second thing is that do not put a fire on the ring on the side of the cup, which is in here. If you light up the fire and then try to burn it on the side of the cup and then put it in here, you will burn the patient, which you do not want that happen. So keep that in mind, that when you light up the alcohol, you do not want to just burn on the outside. This will heat up the side that is in contact with the patient. So rather you want to put it inside and rinse a little bit and then after 5 minutes you can remove the cup by depressing the skin down. This way the air will go in and the cup will release by itself. If you just randomly pick it up, sometimes the suction can be too strong that you might give some discomfort to the patient, or in the worst case, again, you may abrade the skin. And when you move, just depress the skin down, let the air go in, and then you can remove. When you remove it, you will see a red mark. This is a result of the suctioning effect. This kind of mark is sometimes can be indicative of how bad the person's problem is. The more blood stasis, the more redness it is. Some theory also saying that if your dampness is too strong, you will give you some water as well. And in the worst scenario, some blister can be formed as well. Do not panic. If it does happen, just make sure to tell the patient that usually it takes about 3 to 5 days to disappear. And if the blisters do occur, just keep it in to ensure that the skin is intact. And in the possible case, if a person's immune system is being compromised, then they might have to go to the primary care and get some tropical agent to put it on to prevent any infections occur. If that patient is on blood thinner, such as coumadin, or some other blood thinner or warfarin, they tend to become very red or sometimes very easy to have a bruising. In that case, cupping might not be an appropriate technique to perform on the patient. You always want to do the cuppings on the person that has a intact skin. Before you do the cupping, make sure that you inspect the skin and make sure that there's no open wound or lesions that occur.